WHO, the World Health Organization, has released two very important initiatives, the Cervical Cancer Elimination Initiative and the Global Breast Cancer Initiative. The role or the purpose of that session was to tell civil society about the initiatives, mostly Global Breast Cancer Initiative, tell them or explain what are the pillars, what are the objectives, and then explain a little bit too how we're going to implement or how the WHO sees the implementation of these initiatives, right? For now, they're just, particularly GBCI is mostly a document, a very important document, a framework, but now we have to move that to implementation. Civil society has to play a role, mostly because organizations, civil society, a lot of the organizations, they do advocacy, they work with their ministries of health, and so really they're going to play a role in pushing their governments to adopt some of the recommendations of these initiatives. Also, there are a lot of organizations that they provide services themselves. When you think about screening for breast cancer, patient navigation, education, all of that in this region and a lot of regions is provided by civil society. So, and because they have to play that role, they also need to understand what's in the framework, what are the best projects if you want to implement, the best buys, what are other organizations doing in the same region that maybe can be adopted or adapted. It is providing that context and that knowledge to the civil society so they can be a real stakeholder in the implementation of these WHO initiatives. The objectives of the Global Breast Cancer Initiative has three pillars. One is the health promotion for early detection, so is what they call the pre-diagnostic pillar. Then there is the diagnostic pillar, and then there is a treatment pillar, right? And all these three buckets have their own KPIs. And then there's some activities or some examples of projects that can be implemented so countries can achieve that KPI. For example, you need education of the population if you want to be able to achieve early detection, but you also need the healthcare providers, for example, the first responders, like low-level, the primary level healthcare providers, to also know to also be educated, be knowledgeable about the signs and symptoms of breast cancer, right? So that is an example, do not just do awareness for the population, but include healthcare providers, education, and community education. If you look at the diagnostic interval, could be the KPI is that should not pass more than 60 days from the first symptoms or from the first time that somebody reaches out to the healthcare system until they have completed diagnostic, not just, oh yeah, you've got a lump. No, they have to have the triple assessment. You can achieve that by maybe incorporating some of the diagnostic centers in district hospitals, for example, in the middle level, and not keep the diagnostic centers up at the tertiary level. So there are all these things that the framework has a lot of really good information, but that now needs to be transformed into actionable projects, right? So little by little, everyone achieves the three KPIs. So the message to civil society is, you are a stakeholder as much as, a policymaker or a hospital. You are part of the solution. So do not give up. Do not think that you're not part of it. Don't accept sometimes that secondary role that civil society is forced to play. Go with confidence and feel that you need to be included. And what I would say to governments, and what I would say also to WHO as they're thinking about the implementation of so I would say the same, do not forget civil society, because they are the ones that they're going to be implementing a lot of the projects, particularly in the first and second pillars. So we have tomorrow a workshop on where we're going to try to disentangle all these things. You know, we're going to have breakout groups, and we're going to ask, what are the things that you can do to implement the framework? What are the things that you need? Do you need resources? Everyone needs resources, money, right? But what are the other resources that you might need? You might need to just, I don't know, travel to visit another project that you want to adapt. All these kind of things. So we can write a little bit of a commentary, I would say, or some kind of a very short piece that said, you know, civil society needs this if we really want to be part of the implementation of the GBCI. There are actually a couple of things. We've done a little bit of background research with the CBCS partners, if you want. These are countries or NGOs from countries that have hosted the symposium in other times. So, for example, in Indonesia, there are two things. They have a project to improve the early detection of breast cancer, and this is using Project ECHO. They're training primary level health care providers in combination with hospitals. So is the NGO, the Indonesian Breast Cancer Society, working with a hospital and then providing all that training for the Ministry of Health or on behalf of the Ministry of Health. That is a very interesting project. In the Philippines, in Manila, I Can Serve, a Filipino NGO. They're using the KPIs from the framework already to track their progress internally with their early detection programs. So they've developed a very nice electronic system to collect the data that before they were just writing in notebooks. Now it's all electronic in iPads, and they have a dashboard, and the dashboard kind of shows them in real time how much progress are they making to the 60, 60, 80 KPIs of the initiative. The WHO regional office has not engaged very actively in the development of the framework, but what they're doing is that they're connecting with their own national cancer institutes, and through the National Cancer Institute, they're writing a letter to the government, to the Ministry of Health, to tell them that they've been involved in the development of the framework and that they'd like to see these, you know, moving forward in many different ways. So yeah, so there, I think that there is a lot of best practices that could be learned between the countries, the CBCS countries.